Hello everyone, my name is Damla Oladoing, and today I'm going to be doing a summary of my paper talking about cancer and how it's affected by both biological and geographical outcomes. Cancer is the leading cause of death, and where someone lives can heavily influence their risk, access to treatment, and survival of cancer. It's important to identify that its spread and its prevalence is not only from biological factors but also geographical factors, as people that live in lower income countries and areas are more likely to get cancer and more likely to die or have serious complications due to lack of reachable treatment. The biological cause of cancer is mutation, and there are two major genes that cause cancer, namely oncogenes and tumor suppressor genes. Oncogenes naturally are proto-oncogenes and they aid cell growth, but when they're mutated, the cells start to grow too fast, causing tumors and then eventually spread and metastasis to other parts of the body. And tumor suppressor genes are naturally meant to control cell death and control cell division, but obviously when there's mutation, the cells that are meant to die are not dying fast enough, or they're not divided enough, which will obviously cause complications as well, which in turn causes cancer. According to the WHO, there are approximately 20 million new cancer global cases. This is really bad and this is really concerning, and this is why this type of presentation and this type of research is to be done, to understand what exactly it is and how we can shift from the biological standpoint of trying to curb it and move towards other important things, which are the disparities that people face that, aid or either destroy their access to care. While biology helps to explain cancer development, social disparities explain who is mostly affected, why they're affected, and what exactly this being affected really means. Generally, people in higher income communities have better access in general when battling diseases like cancer. Now, what this better access means is, better infrastructure, better hospitals, better treatment and screenings, early diagnosis, and they have fewer mortality rates. Now, who are the stakeholders or the individuals of interest? This consists of patients and their families, healthcare providers, the government, and pharmaceutical companies. 3 case studies were brought forward from sub-Saharan Africa, the United States, and India. Now, these cases all point out that lower income communities and countries are in fact hit harder with things like cancer. Yes, there is higher incidence in some higher income countries, but there is way more mortality in lower income countries as less attention is paid to them, meaning there's less access to care, and especially in areas where, there's more violence or more, war going on, they are the ones that are hit the most, as no one even looks their way and people keep dying and they're deemed as not important, which is wrong. A major cause also of this spread and this disparity, especially in lower income countries, is late diagnosis. Now, according to a lot of religious beliefs, some people believe that if you come down with a disease like cancer, it may be a curse, or you have to go and pray and you have to take some local medications. I know in Nigeria, which is the country I'm from, a lot of people don't believe in sicknesses like cancer. Instead, they go to traditional doctors and they use all kinds of herbs and things, and they believe that it's gonna go. Meanwhile, this cancer is growing, and for an issue like cancer is not like some other diseases that it doesn't matter if you diagnose it late, you can still be treated from it. With cancer, the more you wait, the more risk of spread rather happens, and it's gonna be bad for the person, and eventually it might lead to death. Now, what are the proposed solutions? Like the first one I mentioned, late diagnosis is bad, and so a solution will be early diagnosis. Being able to, if a patient rather, or a person feels a lump or discomfort or some symptoms that may be linked to cancer, they need to go to the hospital, get the proper screenings early, because like I said, the later you wait, the worse it gets. Another thing is prevention, like vaccinations. I know there's vaccinations for hepatitis B and HPV, which have been linked to be related to some kinds of cancer. Another prevention tactic is tobacco policies and regulations that can help reduce the cases of lung cancer and other lung diseases. And a third thing that is important and everyone knows but still shy away from is good nutrition and good exercise, because a healthier person is less likely to have cancer and is more likely to be able to fight it. A third solution, and a very obvious solution, is increase access to treatment. There needs to be equal access to treatment despite where someone is geographically located. And also international support for low-income countries is very necessary and very, very important as well. In conclusion, cancer is a social and biological issue. It's something that needs to be looked at from both sides, not just something that, oh, it is mutation, and so let's focus on it from a biological perspective, a medical perspective. No, there's also social factors that affect cancer outcomes, and even the onset of cancer. People need to understand that people that are less privileged and in low income countries, they keep getting hit worse because, this reduces their economy. A low economy means there's less money for the country, meaning there's less infrastructure, and less infrastructure means there's less access to treatment. Less access to treatment means more mortality. And so it's important to focus on these countries and understand that they need help, and we need to all work together to help these countries and raise awareness. Also, access does affect survival, and it needs to be stressed that it does affect survival. There's, according to my essay, I've put plenty points from different medical journals and websites saying that it does affect survival, and people that have no access to these treatments and these healthcare facilities are gonna die, and they're gonna be affected very deeply, and their families as well. Thirdly and lastly, we must ensure as a people good cancer care despite the region of residence. No matter if someone is in a lower income country or a higher income country, these higher income countries need to work together and join hands to help these lower income countries so they can have better health outcomes and be able to fight cancer. Thank you everyone for listening to my presentation.